Jake Meyer here with WAVE Physical Therapy and Pilates, coming here for part 2 of trying to figure out why you have knee pain. So now we're going to talk about control. 2 drills we're going to go over for this one is going to be a step down and a lunge. Okay. So first, for the step down, what you're going to do is pretend you're at a stair and you're trying to walk down a stair, or it's more like almost like a single leg squat, like you're sitting in a chair. So what this looks like, you're going to stand on one foot. Your other foot's going to stay straight, and you're going to reach out in front of you. You can either tap your toe or your heel straight out. Your bottom, again, pretend you're sitting in a chair. You're going to kind of sit your butt back, keep your chest up and coming down and in, okay? What we're looking for is how far that foot can go. Can you reach very far? Can you let that knee bend, or is it causing pain? Or is it hard to control at your hip? What you're looking for is your control through here. So if I'm coming down and that knee is just wobbling all over the place, that's going to either mean my ankle or my hip is weak. You can kind of differentiate a little bit. If you just feel like that hip's kind of just like caving out a little bit, or just really hard to control at your hip, that means you got some hip weakness. Sometimes that is some foot weakness, but I find majority of the time it's more at the hip. The next thing you can do is a lunge, okay? A lot of times when we have some knee pain, doing a forward lunge is just the last thing we think about doing, because it's just going to seem to irritate the knee. So one modification at first would be doing a reverse lunge, where our momentum's kind of going backwards, and you're able to gently sink down to strengthen both our glutes and our thigh. If that's too much, I like doing a static lunge, where basically you come into a split stance, drive your back knee down, letting your front knee bend. As you do this, if you can come all the way down without pain, fantastic. If it hurts a little bit, stop at that level. Don't go any lower than the pain. Maybe look for like a 2-minute hold time, work up to that, but really just looking for fatigue. When that leg just feels kind of gassed out and it's just tired, you've probably done enough for the day. Move on and maybe do it, skip a day, do it again. Build that strength over time. So again, we're here, coming in, stay above the pain, coming back out. So those are 2 ways you can test your control at your ankle, knee, and hip. I'd love to know which one you found to be the most challenging. Like or comment below, and follow us at WAVE PT.